We do focus on smaller practices where most of the software competitors that we deal with try and go for the most bang for their buck and look at larger practices as well as hospitals. As far as what you get in return for your investment, you're going to save time and it's going to increase your productivity. The way that you're going to save time is when you use a third-party practice management along with Amazing Charts, you'll connect those two softwares through an interface, and there will be a reduction in double entry, but not an elimination of all double entry. For example, if somebody were to change their demographics, maybe their home residence were to change, you'd need to change that in two software products rather than being able to make the change in one and have that change occur on both sides. With our practice management, everything that you do should happen in real time, and any change you make on one side will be reflected on the other side as well. And then the last question on here about who should use Amazing Charts Practice Management. This is something that becomes a common discussion. To use a practice management, I would hope everybody understands it's a product and it's not a service. And what I mean by that is that you would need somebody on your staff that understands billing and is able to efficiently process your claims using the clearinghouse built into practice management. This would include knowing coding and how to do follow-ups and making sure that everything is submitted correctly the first time to reduce the number of denials or rejected claims that you might have for user error. A lot of people think that a practice management software will do all of those things for them, and it won't. It still takes a person at the other end to operate it. I give people the analogy of it being like a toolbox, but you're going to be doing it yourself. For offices that have a person like that on staff that understand billing, they obviously are going to save a lot of money compared to paying a third-party biller service for a net percentage of their collections. This way they'll have a fixed monthly payment for the software licensing and nothing else other than the staffing salary already covered within your budget. Okay, to the next slide. Eligibility. Amazing Charts Practice Management offers real-time eligibility checking that can be scheduled to run at your convenience or on the spot. This will be very helpful with people making sure that their insurance that they're going to be giving you is something that is active and you will end up receiving payment. All of us know that it can be a pain to find out after the fact that a patient that was in here no longer has the coverage that they submitted, and now we're having to chase down that patient to get the payment for that visit. The customizable schedule. Amazing Charts Practice Management lets you customize the way schedules are displayed, such as colors, time increments, font size, display size, and more. This is something that we built into the product because for years and years on the EHR side, we had a lot of requests. Can we have our schedule built in different colors? So we could either color each provider a different color or a status of an appointment a different color, whether the person's in the waiting room, whether the person's in the exam room, and so forth. So a lot of people find this schedule to be very useful and a lot easier and more user-friendly. At a quick glance, you'd be able to tell what's going on without having to read into it so much. As far as the data integration, this is the part that I was speaking about earlier, that your demographic and appointment and all your charge information is accessible and can be viewed both through the practice management software and the EHR. Both of those are going to live in the same place. You're going to see when you start using Amazing Charts Practice Management, you'll be installed with a new box up next to your messages box, and it'll say ACPM. You would just click on that button, and it would bring you to the practice management screen. For clearinghouse integration, electronic claims and payments flow seamlessly between PM and the clearinghouse. Direct access to the clearinghouse portal will save you time and money with real-time claim status. So you'd be able to check in real time what's going on with my claims, run reports on it, and be able to see what's happening behind the scenes, where a lot of times people with their billing, if they're using a third party, submit their bills, and what's happening behind the scenes they don't know, and then they just receive payment for some. They don't know necessarily what happened with the ones that they didn't receive payment for. This will give you access to all of that information at the click of your mouse. to the next slide. Here you'll see some testimonials from a few of our users. I'm not going to read these out to you guys, but these will be included in the email that's sent to you, and there's case studies that are listed under this link that's included here as well. So rather than just reading like a small quote, you'd be able to read the full story, figure out what led to the person's success on the other end using practice management from Amazing Charts. And as far as pricing goes, this is a common question, and obviously it's one of the most important things for people. Practice management is priced based on the practice size. It's going to be $249 per month per practice. And then for practices that have multiple providers, which means more than one, there would be a charge of $99 per provider monthly. So to give you an example based on those numbers, a one provider practice would be able to use practice management at $249 per month. If you were to move up to a two provider practice, you would pay the $249 plus that $99 each per provider for a total of $447. The financial obligation is a 12-month period, and the process begins with you seeing a full demo, working with some of my sales reps as well as my support people to show you what it is that you're really looking for in the practice management to make sure that it meets your needs. From there, you'd be assigned to a dedicated practice management implementation specialist. This would be your direct contact for onboarding into the practice management software. The average time in onboarding runs as little as 10 weeks and as long as 14 weeks, depending on scheduling and your availability. And as I mentioned, it's a 12-month contract. The way it's set up now, you do not start paying anything until you are either installed or until 14 weeks passes by. And the reason we choose that 14 weeks is because on average we can get them all done in about 10 or 11 weeks. So it leaves about a 3-week cushion in case your scheduling might be a little bit tighter on the other end to get it done in such a quick time. And as far as some comparable options, one of our members of our CAB, or our Clinical Advisory Board, has recently switched to our practice management, and prior to making that change, the practice management solution he was using ran about $350 a month for each provider. And on top of that, there was the addition of an interface connection between two softwares, and then also the time management issue of having to do double entry when there were changes. He's made the switch now, and with the complete integration, the biggest savings is probably going to be time in my mind. But as far as dollars go, you can see here he was able to cut his costs by about $9,000 a year from switching from his original practice management to Amazing Charts Practice Management. And you'll be provided contact information to reach out to my sales department if you do have any specific questions on pricing or custom setup for your practice. Feel free to reach out to us, and we'll be glad to help you out with anything that we can. And with that, I'm going to pass it along to Katie, and I think that we are up and ready to show you Amazing Charts Practice Management.
Time for questions. So I'm not sure if everyone heard me. It looks like that I just got unmuted, so I may have been talking to myself for a few minutes. Let me just introduce myself again. My name is Katie Phelan. I am one of the practice management trainers here at Amazing Charts, and I do appreciate everyone's time today. What we're going to do with the remaining time is a high-level demo of the product so that you can see some of the integration between Amazing Charts PM and Amazing Charts EHR. If you are interested in getting a more deep dive demo, you will have plenty of opportunity to reach out to the sales team and have one of our demo specialists provide that in-depth demo to you, just so you can see it a little more of how it's going to work for your practice. So I'm going to go ahead and share my screen with everyone. So everyone should see my Amazing Charts environment. So everyone is familiar with Amazing Charts. And Adam spoke briefly a few minutes ago how the integration works as far as accessing Amazing Charts PM from the Amazing Charts EHR. So up here at the top, you'll notice I have an additional button, ACPM. This allows you to launch Amazing Charts PM from Amazing Charts EHR, and it brings you directly into what we consider Amazing Charts PM's home screen, which is the front desk. But there are multiple ways to access Amazing Charts PM from AC. For example, if you wanted to access it, let me just bring that up. So it looks like there might be just a little bit of a delay. Here we go. So here is what we call the front desk area or the main screen of Amazing Charts PM. And then to quickly toggle back and forth from the PM to the EHR system, you'll notice down at the bottom of my screen here, I can then choose if I needed to go back to Amazing Charts for one reason or another, and then once I'm in Amazing Charts, I can go back to PM. You'll also have the ability to launch a patient's chart right directly from Amazing Charts, and there are a few ways to do that, but I'm just going to show you one. Right from, again, the main screen of Amazing Charts, if I have a patient up in the patient list, I can use a window to get into Amazing Charts PM, but this time it's bringing me right to their chart. So this is really nice from a front desk point of view. So we like to consider the check-in and check-out process for your front desk staff to be pretty streamlined with the two products. For example, if you were going to register a new patient, and typically after you register that new patient, you want to book them an initial new patient appointment, right from front desk, where your front desk staff would spend the majority of their time, because all of the links that they would really need to access throughout the day are available right from here. One being the patient registration screen. And you have the choice to do a full registration or what we call a mini-reg. The only three fields that you really need to be concerned with filling out initially in Amazing Charts PM are the name, gender, and date of birth. This allows me to quickly put a patient in the system and book their new appointment. So then once I hit save, it's going to show me Emily Prue's newly created chart. And there's a lot of what we call quick links built through the product. And one of them is located right here. So I could easily use this quick link to now launch my scheduler and book Emily Prue an appointment. And you can do that even for an established patient's chart. So if I'm in Arnold Allen, I could still, even though he's an established patient, use that quick link to go to the appointment book. And what this allows is when a patient is actually on the schedule and they're coming in for their appointment and they're now checking in, you can do the vice versa effect. From the schedule, and as you can see, some of that color coding we were talking about, you can see that you can color code the headers and the available time slots along with the unavailable time slots. I can access a patient's chart right from here. If I right-click on my test patient, Arnold Allen, I have the ability to choose to go into his chart. And unlike the clinical product, you can have multiple charts open at once. So this is really nice, not only for front desk, but all staff with a busy practice, that you can navigate back and forth to different patients' charts and even different screens for that matter, so that you can multitask. And then from here, if I needed to review any of the patient's information during check-in, the patient's chart is really a one-stop shop. Everything that I would need to know about the patient presently or historically is going to live within their chart. So you can see the breakdown of all of the information so that you will even know what is located under each which pane. And of course, depending on how long the patient's been with your practice and what is really required for that patient, some patients' charts are going to be more robust than others. So then if you wanted to collect and enter a patient payment because the patient had a copay, you could collect that and enter that right from within the patient's chart as well. And then after you enter the patient's payment, you would be able to confirm that that payment amount was successfully entered, because the system will automatically route you back to the patient's chart, and you'll be able to see that their money is now sitting in an unapplied bucket. And then because I already have my schedule open over here on the left, I can go right back into my appointment scheduler, and I can now check Arnold Allen in. And we use what we call appointment statuses that allow us to change the status of a patient's appointment. So you can mark a patient checked in, checked out, or even missed, which indicates they no-showed for their appointment. And back to the color coding, you can even color code appointment statuses. So you can see that Amy Smith is now green because she was marked checked in. Eligibility is also very important for practices, and we take that into account. So there are multiple ways that you can choose to run eligibility and view eligibility in the practice management. So that's what we consider to be one of our key features. So if I wanted to check a patient's eligibility right from the schedule, again, just to go back to that check-in, check-out process, I can right-click on the patient's appointment, and if this patient was successfully set up for eligibility check-in, I would have a check eligibility link. Or if you prefer to do it right from within the patient's chart, where their insurance information is located within their chart, there's also a check eligibility link. Now, of course, we can't set up our test environments for eligibility check-in, so obviously mine don't have it, but they check eligibility just like all of these other options here. Now, that's considered a manual eligibility check, which is really important because the patient comes in, their insurance changes, so you want to do on-the-spot checking. But we also offer automated electronic eligibility checks for patients that are scheduled and have an active insurance. So if you want the system to do the work for you, and for no extra fee, we can set you up with electronic eligibility for all payers that participate. And the system will automatically go out and run eligibility for the patients that are on your schedule. And you can choose whether you want that eligibility to run a day before their appointment, 2 days before. So you get to choose when you want that check to be done. You could even do it the morning of. And then your front desk would be able to see from the front desk screen the eligibility status of that automated check. So this Manage Appointments area, the front desk screen, is an alternative option to managing your schedule. Most people like the appointment scheduling screen because of the color coding and other customizable features, but we also have this available to you so that you can see all the patients coming in. You can sort it by resource and location if you wish. View the status of their appointment, reason, resource, time, and take action, including doing another eligibility check if you wish to do so. And then, of course, if the payer responds back with benefit information, you will get that in Amazing Charts PM2. So you'll be able to click on the eligible hyperlink and get the benefit details for that individual patient. Or if the check is not successful and they come back not eligible, you'd be able to get a reason for why that eligibility came back with that status. We also have Outstanding Recall Summary. This is an optional feature in Amazing Charts PM, and it may be something that you use in your current PM system. So I know a lot of people are looking for this when they are looking to go on another PM. So this is basically the ability to book a reminder appointment for a patient instead of actually scheduling them on the appointment scheduling screen. So for instance, my son has a 3-year follow-up appointment just the other day, and he doesn't have to go back for a year. So she told me, you know, we don't book appointments at this time, you can call back. Well, instead of that, if they had a recall system, they could have simply set up a recall for my son, you know, maybe 10 months, 9 months, 8 months, however far along they choose, and then they could call and remind me that it's time to book his appointment, or they could send me a postcard or letter. So we have that ability in the practice management system. So now let's talk about the billing piece. That tends to be what people are mostly intrigued about, even though your front desk is important and you want to make sure that your front desk isn't going to have to jump around to too many different places. So the billing component is comprised of 2 pieces, electronic charges and manual charge entry. So the electronic piece stems back to Amazing Charts, and the providers have the ability, when they are done seeing the patient and they're in that patient's encounter, to actually use an electronic encounter form, code the level of the patient's visit, sign off, and transmit the details of that patient's visit over to the PM so the biller can review it, make any necessary changes, maybe add modifiers, link referrals, etc., prior to billing it to the clearinghouse. So the sign-off screen, as you'll see in a second, has the electronic encounter form right on it. And this is customizable in Amazing Charts. And after the provider codes, they see the charges, so they can confirm that, you know, the CPT codes they selected were accurate. They do have the ability to add modifiers. Most do not want to do that. That's why that's something you can do in Amazing Charts PM during the review process. And the system will automatically attach the ICD-10 codes to the CPTs. And then at the time of sign it will then trigger Amazing Charts to take the details of that patient's visit and transmit it over to Amazing Charts PM. And all of that electronic information or electronic charges that come over from AC exist right within the patient's chart in Amazing Charts Practice Management for your biller to go in, review, and make any necessary changes to it. The other option, being the manual charge entry, is used in circumstances where maybe the provider doesn't need to be involved. hospital billing, or maybe you have retail services, etc., miscellaneous codes. So you can, right from the patient's chart, enter what we call manual charges. And then at the end of day, when it's time to transmit your claims, we use a batch process like many other systems. And the batch process is pretty straightforward. It's all done within our billing application. We do give you some filter options because depending on your practice's needs and how many providers are in your practice, location, you may want to omit certain claims from your batch initially. You may be a day behind in your billing. You may be credentialing with a certain carrier. Maybe you have a new provider that's credentialing. So that's what these filters are here for you. And then you always have the ability to do a second review at the claim selection. Otherwise, once you batch up your claims, they show up automatically under the billing section, under Manage Claim Batches, for you to validate, and that is our amazing chart scrubber. If all of your claims pass the validation, you then be able to transmit them. And you can work your electronic claims and your paper claims separately. So then you would be able to go in and work any paper unprinted claims. And nothing ever necessarily gets deleted out of the system. It just goes into different buckets once it's changed statuses. And then, of course, once you transmit the claim to the clearinghouse, the next step is to know, where is that claim in process. So one nice feature, or one of the nice features of Amazing Charts PM, is that you have direct access to our clearinghouse portal. So you're provided with a login, and right after you transmit a batch of claims, within minutes, you can go into the portal, find the claim batch, and view the status of that batch of claims. And you can see the clearinghouse use a color-coded system, so you can easily recognize which batches need attention versus which ones successfully passed the validation process at the clearinghouse level and were forwarded to the payer. And in addition to seeing the status of your claim batch when it's initially submitted out of ACPM, you can also get other claim statuses. You'd be able to see at any time if a claim was forwarded, accepted, rejected, adjudicated, denied. So the clearinghouse allows you to see all of those different claim statuses for your claims. And because the eligibility, electronic remittances, and payer acknowledgement reports have to go through the clearinghouse before they come into the practice management system, you have the ability to view that information right from within the clearinghouse as well. Most people prefer to do as much as they can right from within the practice management system, but this is just an added extra for our clients because you have that direct access to the clearinghouse. And there's no additional fees for any of this. So once the payer sends that response report back, that comes into Amazing Charts Practice Management under the Manage Claim Report section. And here's where you'd be able to review that report and archive that report. And of course, if further down the road, if needed, it can be used to dispute timely filing. And then payments. So your ERAs and your payment posting all occurs in the bookkeeping area of Amazing Charts Practice Management. You also have the ability to manage other payment types from here as well. So what's really nice about the system is you saw on the billing screen, this is going to be the typical workflow for a biller. They need to send the claims, validate them, work their paper claims, get their payer acknowledgement reports, and we even have a place for statements. But then if you have someone separately doing the payment posting, they have their own screen where they would be able to view the electronic remittances that come in the system and post those electronically. And the payment posting process for electronic remittances is pretty straightforward. And then, of course, do manual payment posting for any payers that do not send ERAs. And then you can work your patient unapplied balances before managing statements. You can see your accounts receivable for your patients and also do your end-of-day closings all within bookkeeping. And then, of course, reporting is pretty important. We have a pretty robust reporting structure in ACPM. All of our reports are labeled and broken down by report type. And depending on the report that you're running, there are filter options. So again, depending on the size of your practice, the amount of locations, the amount of providers, the carriers that are important to you, you can choose, what information you want to display on the reports. And also how you want the reports to run. Do you like them by service date or do you prefer them by transaction date? And all of our reports can be saved for up to 3 months in Amazing Charts Practice Management. So you can decide once you save a report, do you want to keep it for an extended period of time or do you want to delete it? So maybe you just ran it to have someone take a look at it, but you don't need to hold on to that report. To our Amazing Charts Practice Management report, going back to our clearinghouse Claim Remedy, they offer analytic reporting as well. So you can see, in addition to those numerous reports in Amazing Charts PM, I also had quite a few reports right in the clearinghouse. And all of the reports in the clearinghouse can be exported to Excel or CSV. And many of them also have drill down capability. So if you wanted to see, total payments by payer, you could get that overall payment amount, but then you could even drill down to actually see the claims attached with that payer's payment. And then going back to claim status, there are multiple Claim Guard reports, so you can run by status, denials, etc. So usually if you can't find a report in one place, you can find it in the other. So that was a high-level overview of Amazing Charts Practice Management. What I'd like to do now is open up the floor to some questions. I did see some questions come through right at the beginning, so I want to make sure that we take the time to answer those questions. So everybody is currently muted, and you're going to remain muted. So if you would like to send some questions through, down at the bottom of the participant panel, there is a questions box and a chat box. If you click on the plus sign next to either one of those, it will expand, and you can type in your question and send it through to us. So let me take a look at the first question we have here. So someone said that they currently use Gateway for their claims, and they were wondering if they could continue to use Gateway. So with our clearinghouse, because of that ability to sign in as a user and use all of the features at no added cost, we do strictly use one clearinghouse, and that is Claim Remedy. but you will work with a practice management implementation specialist here at Amazing Charts to get you transferred over to our clearinghouse. You will also have your own designated clearinghouse rep from our clearinghouse that would help you through the process to, get your EDI paperwork completed, and that's for claim submission, and also your ERA paperwork completed so that your ERAs can be routed into our clearinghouse in our system. And as much as I understand it's hard to get rid of the clearinghouse that you've been using for so long, I find that most people, are happier once they come on to ACPM because they have all those extra features with our clearinghouse. Great question. Another question, how long has ACPM been up and running? So I think kind of given a little background in the beginning. Amazing Charts Practice Management started February of 2015. So I can say I've been here for a little over a year. I've been here since May 2015, and within a little over a year, we have had some great progress with our system. We will acknowledgement there's been some speed bumps at the beginning, and we definitely take full accountability for that. But we have a structure in place internally to make sure that, moving forward, we do not have, the same problems that we had maybe at the beginning. Because, you have to make sure that you have the right staff and everyone's trained. Not to mention, we just recently took over the product in-house, which has made a huge difference. And I think all of our clients are going to see a big difference now that we've been able to bring the product in-house. Another follow-up question to that was how many practices are currently using ACPM? So that might be a better question for Adam to answer. I have a vague idea, but he probably has a better idea than that. So Adam.
And I believe that we have about 200 providers that are using Amazing Charts Practice Management right now, and I think it's about 150 practices in total. We are usually onboarding and installing on average about 15 to 20 providers each month at this point.
Great, thank you, Adam. Another question is, if I am interested in receiving a demo, what are the steps that I need to take?
For that, I would recommend just reaching out to our sales department, and one of our sales executives would go over some of the details with you. And we also have a practice management sales specialist who is an expert in practice management and billing, and he would be able to walk you through an in-depth demo of the product. I usually recommend that people set aside at least an hour because there's going to be a lot that you want to see. So to jump from here to here and go over each topic, you'll probably want to set aside at least 45 minutes to an hour to see everything that you can.
And I'm going to go ahead and put that sales number back up for everybody as well. So if you are interested in reaching out to sales, you can do that. And is ACPM consistently updated and improved over time, or is this the final product? It is absolutely not the final product. Again, in just a year, we have already made significant changes to the product to help our user experience. But we have a very exciting roadmap for the rest of 2016 and into 2017. So our product team has already put together in place a number of enhancements that we're going to be making to the product within, the little over the next year or so. Great question. how long will the price remain at $249.99 per additional PCP or provider? So Adam, I'll let you take that one. You may be still on mute.
Yep. Could you repeat that one, Katie?
Sure. How long will the price remain at $249.99 per additional provider?
We have no plans to change that pricing at all. Originally, when we released the product, we started out with a pricing model that was based on billing NPIs, and we were charging $249 per billing NPI. And we realized that going with this model would make it a little bit easier for us to match, because with Amazing Charts, you have licenses for providers. We would just match that number. And we wanted to keep the cost reflective of where our costs are with Amazing Charts as well. Most of you guys chose our software for the combination of both the usability and high rating, as well as the price-friendly bump on your pocket. So we wanted to keep practice management also in line with that. So that pricing is good to go for at least through the next year, as far as I can see.
Great. And it looks like we have one more question. How soon can we start the service? So I'm thinking the question is, how long is the implementation process?
Yep.
Yep, you can go ahead with that too, Adam. Thanks.
Yep, no problem. So as I explained, the implementation process usually lasts, on average, somewhere between 10 and 12 weeks. We've had some practices that put a lot of time availability on the block for us to use, and we've gotten them on in as little as 8 weeks. And then again, we've had some that had scheduling conflicts that dragged out to about 13 or 14 weeks. So it's going to be a minimum of 8 weeks, and it's going to be no more than 13 to 14 weeks. That would be the complete implementation, which would include some training, some hands-on, going over setting up your tables, making sure that we can get all of the data transferred that we would need to.
Right, and yeah, just so I may add, it definitely depends on your internal process as well. You know, how eager you are and the staff is to get up and running, because of course, you know, as Adam was saying in the beginning, you want to make sure that you have the right staff to come on Amazing Charts Practice Management, that they have some basic knowledge of other PMs, and they have to be dedicated to learning the product. And then, of course, the EDI and ERA paperwork, you know, for the payers takes a little bit of time, but we find as long as everybody's on board and everyone's getting the information back in a timely manner, again, it can be 8 to 13 weeks at the most. And you don't want to rush it too much, to be honest. You know, rush jobs are never good. Nothing ever ends well with that. All right. So I think that's all of the questions. Of course, our sales team will be following up with those of you on the call. So if you have any other questions, you know, you can wait to hear from someone, or again, our telephone number for our sales department is on the screen. Please don't hesitate to jot that down and reach out to us if you have more questions, or if you are interested in that deep dive demo for your practice. Adam, do you have anything else to add?
I do not have anything to add, but one thing that I will mention is that we do have a list of all the people that registered. As I mentioned earlier, we will forward you a copy of this webinar, and I will have one of my sales execs reach out to you guys to see if you do want to schedule a demo with our support specialist, or if you do have any questions that we may not have gotten to today.
Great. Well, thank you so much, everyone. I appreciate it. Enjoy the rest of your day and week. Take care now.
Thanks, everybody. Thanks, Katie. Bye-bye.
Bye, Adam.